Good morning, everybody. It's 10 o'clock here in Sweden. My name is David Chalom. I'm a senior consultant in orthopedic surgery and a consultant at TOBAKSFAKTA, which is Sweden's independent think tank funded by the Swedish Public Health Agency. I want to thank the World Federation of Public Health Associations for inviting me to talk about how nicotine poses a serious threat to public health. It needs to be reviewed by the WHO and scheduled for strict international control by the United Nations. I'm going to be speaking a little bit about tobacco, somewhat about nicotine. I'll be talking about new nicotine products, school children in Sweden and nicotine products, and what experts and conventions say. And finally, what can be done? So, tobacco, this is just summarizing the most important things in our dealing with it right now. It is the leading cause of non-communicable diseases worldwide and the leading cause of preventable death, which we all know about. It kills 2/3 of long-term cigarette smokers. The addictive agent in tobacco is nicotine. Please remember this. Nicotine is the problem. Most smokers become addicted to nicotine as children, teenagers, and they want to quit. Remember, no nicotine, then tobacco use would not persist. Nicotine is found naturally in some plants, including tobacco, where it serves as an insecticide. In most countries, it's forbidden for human use in agriculture due to its toxicity. It's an extremely potent neurotoxin that affects the central and peripheral nervous systems. It has a wide range of light intoxication symptoms like nausea, throwing up, stomachache, headaches, but the whole range that reaches also convulsions, arrhythmia, and death, depending on the dosage. Nicotine is a highly addictive drug, maybe more so than cocaine and amphetamine. It also affects mental functions, especially during development until the age of 25, the development of the brain. During the brain's development, it increases its tolerance. That is, it increases its tolerance towards nicotine. It also increases the risk of addiction to other strong drugs, narcotics, and alcohol. The earlier one starts, the more difficult it is to quit. Nicotine also constricts blood vessels, reducing blood supply to tissues and organs, including the brain. This can lead to their fragility, their injury, degeneration, disease, failure, their decreased healing, and their early death. It affects nerve cell proliferation in the central and nervous systems. More nicotine, the less regeneration. It also affects mental and emotional health. It affects all the stages of fertility and procreation. For a pregnancy, for example, spontaneous abortion. The fetus itself, you could be born with less weight or stillborn. And if you are born, it could lead to sudden infant death syndrome. And during their development, their physical and mental health. What about nicotine products? The use of e-cigarettes, for instance, and other nicotine delivery systems, especially nicotine pouches, is rapidly spreading. In Sweden since 2016 and worldwide now. Their use and abuse are drastically increasing, mostly among non-smoking children and youngsters who become addicted. Many then go on to smoking conventional combustible cigarettes. The tobacco industry has and will always exploit loopholes in product regulation. Right now, producing nicotine analogs, they're way ahead of control measures and regulation to continue their addiction-based business. This is white snus in Sweden, or nicotine pouches as you know them. It announces that it has less toxicants than a cigarette, in English, in the blue there. And the Swedish warning says, this product contains nicotine, which is a very addictive substance. Now tell me, is it okay? Is it okay to sell this stuff as long as there is a warning that it's very addictive? Is that really okay? Now, to increase the attraction to and increase their addictive effect, nicotine products are marketed now in thousands of fruit, herb, and candy flavors, targeting children and youth around the world, promoting a lifelong nicotine addiction. In the internet, we can find a vast diversity of other nicotine products, like jelly beans, puff bars, ice cherry gum, Skittles, horny candy, nicotine liquid, Candy King Air strawberry, 8,000 puffs, gummy bears, lollipops, and for the young lady, Kelly White, very elegant. There's also mints and Tic Tacs, pellets, and even glossy lip balm, which I found, but I forgot to put in pictures. In Sweden, the Council for Information on Alcohol and Other Drugs have carried out a school investigation from 2012 until 2024 on 9th graders and second-year high schoolers. The percentage of smokers for 9th graders has since 2012 decreased successively until 2021. And then it increased a bit and it sort of flattened out. And for the second-year high schoolers, it's the same trend, even though the prevalence is higher. So again, an increase 2021. Now, remember this increase from a few years ago. They're smoking more. Snus, which is the oral moist tobacco in Sweden, has been quite steady for 9th graders. Incredible, isn't it? And until 2019, 2018, where it started to increase. And the same thing for the second-year high schoolers. So snus is increasing at the same time that smoking has been increasing. White snus and nicotine pouches 2024 were asked about specifically. The first 3 columns are the 9th graders, and the middle column there are girls, 30%. Second-year high schoolers, the girls are the 5th column, and it reaches 50%. This is incredible. E-cigarettes, also an increase from 2021 for both 9th graders and second-year high schoolers. What do experts say? I'm talking about independent experts, not expert tobacco industry. The European Respiratory Society, the ERS, Tobacco Control Committee, finds lack of evidence supporting the tobacco industry's claims that use of other nicotine products to quit smoking leads to better health. Contrary to the tobacco industry's claim, the majority of smokers want to quit, and many dislike being addicted to nicotine. And there is lack of evidence to support their claim that alternative nicotine delivery products are effective smoking cessation tools. We can see that with children. the majority of e-cigarette users continue to smoke conventional cigarettes as well. Evidence-based tobacco dependence treatment exists, is safe and effective. You know about Champix, you know about Cetirizine. Independent evidence shows nicotine products remain harmful and addictive. So, those are the experts in the medical field. Then we have our governments that ratified and support the WHO's Framework Convention on Tobacco Control, which aims to minimize and eliminate tobacco consumption in all its forms, exposure to tobacco smoke, and nicotine addiction. The United Nations Convention on Children's Rights is also supported by our governments, which intends to protect the children's development and health. These are the United Nations Agenda 2030 Sustainable Goals, 17 goals, which include everything you can imagine. And our governments also support these. And we also know that all the 17 sustainability goals are affected by production, distribution, and sales of tobacco and nicotine products, affecting everyone and our future generations. So, how many children are becoming addicted as we speak? I don't know, but any number is not good. How can they be protected against these nicotine products? What can the United Nations and the WHO do? What can your government do? Or what can your organizations and the NGOs do? Our countries are parties of, and they abide to the United Nations Single Convention on Narcotic Drugs and the United Nations Convention on Psychotropic Substances. Substances that come into the market, new or old ones that haven't been reviewed, they are reviewed when a country or party to one of the conventions that I mentioned above notifies the Secretary General of the United Nations, or when a body of NGOs notifies the WHO. That's us. And what do we notify the WHO? That a substance poses a particularly serious threat to public health, and it needs to be reviewed. And I think I've shown you that how it poses a particularly serious threat to public health and needs to be reviewed. So the United Nations, once they have been notified, or Antonio Guterres, it's the Secretary General, by a country that nicotine poses a particularly serious threat to public health, then the United Nations will request the WHO's expert committee on drug dependence to review the substance. The same thing can happen when, again, I repeat, a body of NGOs notifies the WHO that nicotine poses a particularly serious threat to public health and needs to be reviewed. This is done on the following criteria. Evidence on addiction potential, we know that. Actual abuse or evidence on ability to abuse, we know that. Remember, we're talking nicotine. We're not talking about anything else, just nicotine. And also therapeutic areas of use. After the review, the WHO's Expert Committee on Drug Dependence may advise the United Nations to place the drug or substance under international control. And this is the way to go, in a strict control schedule. Now we know that since nicotine is very addictive, is very liable to abuse, has little therapeutic value, and poses a particularly serious threat to public health, it fulfills both the United Nations conventions for narcotic drugs and psychotropic substances. Those criteria to be placed under international control according to the United Nations most strict schedule. And this we would be doing for a nicotine-free generation. So what can you do for your government to notify the United Nations? Or what can your organization do for your NGOs to notify the WHO that nicotine poses a particularly serious threat to public health and needs to be reviewed by the WHO to protect our children? Thank you very much. Okay, I see a question here from Prajwal Piakarel. We have been doing anti-tobacco campaign in Nepal. What is the best strategy for behavioral change among school students? I am going to tell you the truth. I am not in behavioral change among school students or behavioral change in addiction. I am, in fact, more of an expert in control, tobacco control. Of course, I am an orthopedic surgeon and I meet patients that need help, including school students. And I have my own little pitch, which I give them. I explain, I have a short motivational interview, which is open questions. In fact, I only have 3 minutes allocated with patients. So it's very concise and it's very, very concentrated, but very effective. But that is on surgical patients. So if you would like to have a short talk about that, for grown-ups, there's Citizen, there's Champix, and of course, motivational intervention. What can be advanced modes of intervention to modern forms of tobacco, like vape and hookah? Now, I don't really know what you mean by advanced modes of intervention, but any kind of intervention to modern forms of tobacco and nicotine are, if they are effective for conventional smoking of cigarettes, that should be able to be applied for vaping and hookah. And there's a lot of information about vaping and hookah on the internet about the effects of it. So they're not any different to what I have posed here during the presentation. Nicotine is nicotine and will always remain nicotine. No matter how you filter it through water, or if you only smoke it in vaping, and we know what the dangers of vaping is, including not only the nicotine, but all the other components of the liquid in vapes. I would like to remind everybody that for more than 2 decades, or actually it was about more than 20 years ago, that an expert group at the United Nations were thinking about composing the Framework Convention for Tobacco Control, as it's known today. Some in the group said, well, if tobacco is so damn lethal, then we should ban it. And then the others in the group said, no, we can't do that because it's a part of the culture. Now, that was more than 20 years ago. And it's other times. We have to speak now about what is the problem. And the problem, the source of the problem, is nicotine. If we had no nicotine in tobacco, then people wouldn't use tobacco. And then we wouldn't have the problems we have. So we have to speak about nicotine and what can be done about nicotine. We have to have it reviewed by the WHO and controlled by the United Nations. And I can say another thing. My greatest concern in life, besides my own children, are the children in the world, because I know that many are becoming nicotine addicts, and they will go on to using any kind of nicotine product and smoking. And they're losing life, years of life, 10 years of life, and unhealthy lives, affecting not just the body, but also the brain, the cognitive functions. Not only the cognitive functions, but also emotional, psychological. And I would love to help people, help the world, and help their children. Thank you very much. Thank you, World Federation of Public Health Associations, for giving me this opportunity.